Carstensen is our speaker today, so I will turn it on over to him.
Okay, well, welcome everybody. I'm glad that you're here with us today, and in the midst of all of this staying at home and staying in your office with nobody else around you or wherever it is that you are. Samantha's in downtown Denver, away from her both home and office, so who knows where you are. But there's lots of opportunities for us during this time of pandemic when we're closed away from our normal functions to learn more stuff. And there's been tons of webinars going on. I've been enjoying learning a lot of things during this time off, and I want to contribute to that. But we also have to think about a couple things. What are we going to do while we're off for our patients who have some need of care? What if we can't tell people that, well, you got to wait a couple months before you can breathe while at nighttime if they're having troubles, or if you have them in an appliance, what are you going to do if something happens to that appliance? Or they call you up and say, you know that CPAP you've been telling me I should use? Well, I just can't use it. What are you going to do? So NDX Keller has asked me to talk to you guys about a solution that we can put together for you with the help of Airway Technologies to help you through this crisis. So my background is I've been treating sleep apnea patients for over 22 years now. I've been working with Dr. Thornton from Airway Technologies since, the late 1980s. And as he grew and became enamored of treating airway patients and developing new devices, he would call people that was close to him and say, man, you got to do more of this. Man, you got to do more of this. So I've been thrilled to be he's been my mentor through my whole process of airway therapy. And last year, they asked me to be the Director of Clinical Education for Airway Technology, so I'm very happy about that. And what I want to do is I want to make sure that you understand that working with great partners like NDX Keller and Airway Technologies, there are solutions for the kind of things that you can do for your patients that can make a giant difference in their health. Now, if you're watching this, you're probably already doing some sleep apnea in your practice. That's great. If you're not, well, we have a plan for you too, and welcome to the group. But I'm going to assume that most of you know about sleep apnea and airway health and AHIs and all that kind of stuff. We're not going to talk about any of those things today. We're going to talk about what you can do because it involves you, it involves your patients, it involves some people that you may not have met yet, and it involves your team. So these are all opportunities for you to use today in your practice. All right, Sam, it was working before, so I got to have control back to be able to advance my slides.
I will go ahead and make you the host again.
Let's do that.
And there we go.
Well, not quite yet. Sorry, folks, it worked in rehearsal. We'll get this back up online right away. There it goes. Nope, not yet.
I can currently see what we will cover today slide.
Yeah, but I don't know how I got to there, Sam, so. Let's try this. There we go. All right. Now we're working. So what we're going to cover today is how can you address your patient's needs, today and during the whole time that you're closed down. And when you get ready to get started, what are you going to be ready to do as soon as you can get started? And there's a number of different choices you have coming up. It's not just, well, telling all of your patients to wait. There's telemedicine, and that's going to become a giant part of what we do going forward in all of our airway therapy. If you're not doing it now, I'm gonna suggest highly that you get started, and I'll show you some easy ways to get started right away with this and things that you can work with your team to set in place some good systems and some ways to make sure that you're ready to go right now for a few patients, and when we get back to work for a lot of your patients. The myTAP is a wonderful device. I love it. That's why we're going to talk about it today. And I'll give you some resources, some actual things you can do. And then we'll answer questions and make sure that I've done as best I can to help you be ready to help your patients right now, and then also when we get back to work. So what's going on right now with this pandemic and our closure? Well, in most states, we're restricted on in-person visits. In Washington State, we can't see patients except for emergencies. There's a process in our state for us to be able to ask a question directly of the people that make those kind of decisions for us and say, well, what about us? And so I sent in a nice letter about what we do. We help people breathe at nighttime. We do this, we do that. And they wrote a letter back that says, nope, you're out. So we can't see patients for in-person visits, even though Airway seems to be an emergency to me in some cases. So we're prohibited. So what does that mean? Can we still do something for our patients? Because to make a custom appliance at Keller, you need to have a scan or an impression. In my state, I can't do that. All right, so I need another solution. In your state, you might be able to. Friends of mine are doing webinars, and I agree with some of my friends and colleagues who say, wow, if you have a patient who's in serious trouble and they have a ton of breathing problems, and you can suit up properly, can you do a scan and then send that data off to a lab to have something made? I'm happy to say Index Keller is open and for business and making appliances right now if you can get them the right information. So if you have an old scan, if you can take a new one and you're able to do that, well, then they're ready to help you. But what if you can't do that? Or what if you're not comfortable doing that? Or your team isn't available to do that? Then what else can you do? That's what we're going to talk about. Telemedicine is something that's going to be part of every dental practice, because we can do teledentistry as well. Now, obviously, we can't do surgery over the wire, but we can check in our patients. We can do things like reinforcing of good behavioral issues like perinatal care and preventive efforts. For airway therapy, telemedicine is going to be something that even the sleep physicians in your community are going to be embracing. A couple weeks ago, I checked all of the sleep physicians in King County, where I am, and all but one office was doing telemedicine visits. But only 2 of the offices out of all those were doing any kind of testing. So they're not seeing new patients either, but they are doing telemedicine. And there are national companies set up, and I'll show you a couple, that are able to help you right now today to talk to a sleep physician, to have your patients referred for a diagnosis, to have your patients referred for efficacy testing, all kinds of things you can do. So you don't have to shut your sleep practice down while you're not able to see them physically in the office. You need a telemedicine portal, and I'll show you one that you can use. It's a good one to get started. There's a number of these though. I want you to know that, and there's a lot of things you can do right now to get going. So what do you have to do? Is there a way that you can still be involved, that you can fit your patients with the right device, with a precision manner of care, and a very personal manner of care? And the good news is those are all possible even while we can't see our patients physically in our offices. So let's not use excuses. And another fantastic thing is that we can keep our staff involved. So we're all dealing right now with the 7A, the payroll protection plan funding. We're applying for these loans, and what are we going to get forgiven, and all those details we're getting from our accountants. Well, what are we going to do with that? It's there to help us keep our teams employed. It's there to help give us money to pay for our teams. Well, if we're not seeing dental patients and we want to do something to make sure our teams are engaged with our practices and doing something meaningful and helping our patients, your patients in their health issues, what better way is it than doing teledentistry, telemedicine with your patients for Airway? And we can develop new systems, all kinds of growth things that we can do for this. So there's a real positive about all this. So here's the myTAP Professional Interim Oral Appliance. If you're not familiar with this device, I think it's kind of magic because it has a thermoplastic fit. So unlike a traditional boil and bite, though, this thermocryl that it's made out of It's hard to take a picture of a white device with a clear silicone cover, so I apologize for that. But if you can see my pointer right here, then the white part in the middle here is the thermocryl. You boil that, or you put it in just boiled water, and that softens enough and it fits nicely over the teeth and hardens back into a white plastic. When that fits like that, it makes a beautiful retentive fit, and it feels very comfortable for the patients. The magic part of a myTAP, though, is it comes in a silicone shield. You get a hint of this on this screen, but there's a soft, clear silicone shield that goes under the lips. It goes around the adjuster mechanism that does stick out through the lips, and that makes that soft and comfortable. But what it does is it makes the myTAP into a nasal breathing machine as well. So not only do we get to position the lower jaw forward to open the oral pharynx, but we also get to promote nasal breathing. And those are wonderful things for our patients to do to get their airway open. It actually works better than CPAP for things because it does more things. It positions that lower jaw forward. CPAP does it. CPAP does a fantastic job of blowing air in to open up the oral pharynx, but what we're going to do is mechanically, and we're going to create better habits. CPAP doesn't do that. And if we can help our patients breathe better through their nose at nighttime, they'll also breathe better through their nose at daytime. And when we filter the air that we breathe through our noses, we get a number of different benefits, and some of those are antiviral. We already know that the tissues inside the nose attract contaminants in the air. It filters the air that gets into our lungs when we breathe through our nose. Nitric oxide, which is produced in the sinus cavities, is a powerful antiviral. Now, can I tell you that the nitric oxide kills coronavirus? I can't tell you that. We don't have that study. But we do have studies that show that nitric oxide is antiviral. We do have studies that show that breathing through your nose produces far fewer contaminants in the lungs than breathing through your mouth. So if we help our patients breathe through their nose at nighttime, then we're going to help them be more resistive to any of the allergens in the air. Right now, my house is covered with pollen. We've had beautiful sunny days, not enough wind and no rain in Seattle, Washington. And so I have pollen everywhere. All my sidewalks, all my decks, everything's covered with pollen. I'm happy I'm not allergic to that, but a lot of people are. Well, if the people that are allergic to pollen are breathing through their noses, their lungs are going to be much healthier. So all that being said, I love the silicone shield and a myTAP. If I haven't made that clear, well, I'm not making my message out there. So let's look at this a little bit. What patients can a telemedicine protocol help? Well, you have patients in two different categories in your practice right now. There are many patients in your practice that have been diagnosed with an airway problem. They've been down that pathway. They've seen a sleep physician. They've done a sleep test. Maybe they're using a CPAP. Maybe they've been told they should use a CPAP. If you've been doing screening in your practice, you know some of those patients, depending on how many of your patients you've screened. If you haven't been doing screening in your practice, one thing you can do is do that right now with an email to your patients to find out if there's an airway issue that they are not treating. So the diagnosed patients are maybe they're not using the therapy that's been prescribed. There are patients that are paying attention to some reports that say that because PAP devices aerosolize the droplets that come out of our lungs when we breathe out, then that can provide a greater risk of spreading those droplets. This is all true. Whether it's important enough to warrant any kind of abandonment of PAP therapy, nobody says that, and nobody knows that information right now. Doesn't mean that some people aren't going to extrapolate that and be concerned enough to want to get rid of their PAP devices, even for a little while. What if you have a patient that you identify as been diagnosed and would like to skip the PAP device, would like to get some kind of therapy going, but doesn't have a PAP, and you find out that their PSG data is way out of date? Well, we know from experience that insurance companies are going to insist on fresh diagnosis before they'll allow any therapy at all, oral appliances or PAP therapy, as a benefit. Well, okay, that's fine, except that as I found out in my area, Nobody's doing any in-house sleep studies anywhere around here. And only 2 offices that I've discovered are using any kind of home sleep apnea testing. So in my area, if I wanted to send a patient back to their sleep doctor, there wouldn't be a capability of having any diagnosis done. So I couldn't get them back on a CPAP. I can't make an oral appliance for them and get insurance coverage because the PSG data is out of date. And then of course you have patients that have an oral appliance and something happened to it. It broke at the inopportune time. Something else went wrong. And because you can't do a new one right now, and some of these devices are not easy to repair, what are you going to do? Say, well, sorry, I can't help you until when? June? You know, sometime when I can see you in the office? You can give them something different. So we have a telemedicine portal that you can talk to them. You can call them on your phone. You can send them something that'll help out. What about the undiagnosed patients? Well, similar kind of thing. Somebody calls you up or you discover them because of an email and they say, well, yeah, I'm really having trouble with this. I'm at home all the time now. I've gained a couple of pounds because of all the snacking going on with COVID. And this snoring thing that my wife has complained about for all this time has come to a head. And I need something to help. And I know you can help me, doctor. What can I do right now? Well, normally you'd see them right away and have an oral appliance done. Well, you can't do that right now. So what else are you going to do? You're going to help them with something that they can fit themselves at home. So the telemedicine workflow is that you connect with your patients by some kind of a connector. You can use an e-blast out of your office. You can connect with your social media. You can spin up your phone calls from your staff. You can have them scan through your patient records, all kinds of things you can do to identify patients at risk for some kind of sleep-related breathing disorder. My favorite probably right now is an e-blast. So you just send an email to all of your patients. Who's going to do that? That's going to be your team that has to do that. So that means you get to involve your team in solving that problem. Get them on a Zoom call and say, guys, we're going to do this kind of thing because we have some exciting new ways to help our patients. So how are we going to do that? And let your team work through those processes, work through the systems, work through well, what are we going to do first? What are we going to do second? We make a protocol up. This will help you later on anyway, and it gets your team engaged with taking care of your patients. Remember, your team is on your staff because they like taking care of people. And by now, if they've been home like ours have, they're kind of chomping at the bit to get back to work so they can do something meaningful in their life. And by giving them a telemedicine option for this is something very meaningful. So you can choose some screening questions. You already know those. Or you can use a stop questions. Just the stop portion works really well in this circumstance. You can use Epworth. You can ask them 2 simple questions about snoring. Do you snore? Has anybody told you that you snore? Has anybody made you move to stop you from snoring? Those kind of things. Real simple questions to identify patients at risk for sleep-related breathing disorders. And then you get on a teleconference with them. So what does that mean? Well, can you just call them on the phone? Of course you can. But what else you can do is you can be more official about this. And there's a lot of telemedicine platforms out there. One choice is Doxy.me. Now, this is a free program at one level. Of course, you can get a professional level as well. And this allows you to take control of telemedicine. It gives you a chance to schedule them. It keeps some of the data available for you. It does allow you to structure what you're going to do. I have no connection with Doxy.me. It's just one I found. And what I want to give you is a tool you can go to so you don't have to search everywhere. You can search, you can use another one. You know, that's not the point of today's talk, but I do want to give you this tool. One of the companies that you'll hear about later does actually use Doxy.me because they found it to be a simple one for dentists to use. It doesn't require you to do a lot of different things. And so it does make it easy for you to implement straight away. And that's helpful in these times when we're trying to find a way to do something right now when we don't always have the ability to sit down and work out a ton of different systems that'll take us a month to sort out. So for undiagnosed patients, you have a concern here. One of them is how bad are they, and what are you going to do later for them? So the undiagnosed patients, what you want is some kind of a report, and it's really great if you have a backup physician involvement here, just like we do in our practice when we discover those patients that ask us about sleep-related breathing disorders. So now we're going to be doing telemedicine. So if you have an undiagnosed patient, as you talk to them first, make sure you get a list of symptoms. What is it that they want to get fixed? What's going wrong for them? What's the problem that they want to resolve? Because you don't have, obviously, some diagnosis. You don't have an AHI. You don't have an oxygen desaturation index. You don't have some of the numbers that we pay attention to. So what you want to do is make sure you pay attention to the symptoms. What is it that the problem is? So what outcome is important to the patient? Get that down. Now, there are telemedicine physicians out there for you to work with. There's lots of them, lots and lots of them, because several physicians who also, by the way, can't be seeing patients right now, are looking for ways to improve their businesses. And so they've created some telemedicine portals. Here are some simple ones. Pristine Medical Billing, if you're not familiar with them, what they've done for a lot of years has been a great biller for dentists doing sleep apnea care. Randy Kern, who runs Pristine, is one of the good guys in our industry. And he has partnered with sleeptest.com, run by Ryan Javenblad, another one of the good guys. And those two people have put together a whole protocol to where you can call Pristine and they will set you up with all the things you need, up to and including presenting full-on cases to your patients. So for the current state of affairs, when you can't do a custom device with Keller, then what you want to do is get the groundwork laid for doing that later on. But meanwhile, you can get them diagnosed fully with a board-certified sleep physician and a face-to-face, and so they can get all done very properly right through Pristine Medical Billing and sleeptest.com. And it's a system you can trust. Of course, you're going to pay for that, but you pay a little bit of money out of that, and the patients pay a little bit of money. Their insurance pays a little bit of money because that's all set up. And so it's not a lot of money that you're going to have to pay for their service. SleepMed RX in the middle is run by Dr. Jagdeep Bijwadia. He's a physician. He does the sleep medicine consulting. Another great guy, another great company. Again, I'm not connected with any of these guys other than they're my friends and they're my trusted colleagues. And all I want you to have today is someone you can go to straight away and start with a level of trust that you wouldn't otherwise get by a Google search. And so you can get going right away. If you decide to use these people, great. If you decide to use somebody else, great. I don't particularly, that's not my deal. My deal is to give you some tools today. So when you have a diagnosed patient, the chief complaint is reviewed for clarity. So they've been and talked to, let's call it Dr. Bijwadia, and they come back to you, and now it's time for you to do something for them. Make sure you're clear on what their complaint is. Then you talk to them about what they've done about it so far and why they want an oral appliance. All the things we would do face-to-face, we can now do in telemedicine portals. And we make sure they have a feel that they can be successful fitting their own appliance. This is a critical factor right here, because we have a number of patients that are nervous about making their own device. That's why they haven't ordered one off of Amazon, for example. But you can assure them how easy it is to fit a myTAP. But if you run across somebody who says, well, I just can't picture myself doing that, and you can't get them over that hump, well, we don't really have a solution for you at that point, because they do have to do something on their own to fit the myTAP. Later, you can do a custom. If they have a serious problem, this may be one of the patients where you have to consider your medical necessity and suit up and do a scan so you can get an order off to Keller to get a custom appliance made. I'm not advocating that in general principles, but I am advocating for talking to the patients through how simple this is. And so, I want to help them understand that this is interim therapy. The myTAP is a wonderful device, but it's designed to last you for a few weeks or a couple months until you can get into more definitive therapy. And then it'll be a great backup after that. So that's how we use the interim devices. Now, here's something interesting you can do for a diagnosed patient, is you can start to set the framework for making a custom device. So as you are engaging them with the myTAP on telemedicine, you can have them take pictures and send you through the telemedicine HIPAA compliant secure portal, pictures of their insurance card. And if you're working with Pristine, for example, they can get started on things like benefit checks and pre-authorizations and things. And then you can then be ready to get them started on a custom device as soon as you get back into practice. And so that's a good thing to get started. So it's not like you're going around the system, you're adding to the system. So another thing you can do with telemedicine, though, is you can connect with your local sleep doc. If you have a great arrangement with your local sleep physician and you would just like to carry on that, make sure you get in touch with her and see, well, how can we work this out together? Because she may be doing telemedicine herself, and then agree on some kind of a way to get people tested. Now, the American Academy of Sleep Medicine endorses telemedicine completely, endorses home sleep apnea tests completely. But one of the things that they've brought out is they said, well, you should only use disposable devices. And there is only one that I know about on the market, and that's the WatchPat 1. It's an excellent device. I've used it myself. And the only problem I have is it costs about $100 for the test. And so there's an issue with that. We'll see about how that works out, but it is available to you right now, today. You can order a WatchPat 1 for your patients and get that done. Go to Itamar and find that out. Another thing that's happening is home sleep apnea tests can be cleaned sufficiently. For example, sleeptest.com, if you go to their website, you'll see their very detailed patient protection oriented and worker protection oriented protocols for cleaning these devices. So I don't think that we have to use disposable tests. I think they're fine. So work it out with your local sleep doc if you're going to use that. If you have your own home sleep apnea tester, then you want to make sure you're doing things correctly, as we all are, for all the things we have to do, and just be careful about that. So in a myTAP version here, so if we're going to make them this, then we're going to ship that myTAP directly to the patient. When they ship to the patient, you're going to get notified, so you know when the patient's getting the myTAP. We've created some videos. There's a video that shows a great deal about how to fit a myTAP. Then I recorded some videos in my office as if I was talking to the patient about how to fit their myTAP. And you're welcome to use those videos. We're going to give you the links to that at the end of the program. Now, what you can also do with those videos, by the way, is watch them and fit your own myTAP and then make your own videos. That's perfectly good. I wanted you to have something you could use right away. And I've done a lot of these devices. So the video steps are doing that, and then you're able to be on the same telemedicine platform if they have any struggles with this, and maybe you get your team member to do this as well, and that another way that they can get engaged. And so you can walk your patients through fitting a myTAP. And then you follow up and make sure they're okay. Now, what about billing for these things, for interim devices? There is a code for that. Most insurance companies don't pay for this code. And so I don't recommend that you make it insurance dependent on making a myTAP. My best recommendation is you do this for a cash fee. And then you can always say, we can always send it in for the insurance benefits and see if something shows up. You can always try that. But my recommendation is just make it a cash fee, make it a reasonable cash fee, and everybody understands this is something that happens for now. And then later we'll do a custom device. For one thing, if you have a insurance benefit for E0485, which is the code, some insurance companies potentially could say, well, we won't pay for E0486, the custom device later on. Now, we haven't run into that problem very much, but it does happen every now and then. So be careful about that one. And there are telemedicine codes available. All the typical E&M codes that we use for medicine are available. There's a modifier called 95 that is the one that says it's telemedicine. And so you can do all of those things that you could normally do in your office if you bill medical codes, just use the 95 modifier. So that part's quite straightforward. The insurance companies aren't having any trouble paying for telemedicine because it's standard medicine. But it can become standard in your practice as well. So the myTAP, why a myTAP? What happened to my video? It's coming up, I guess. Why a myTAP? myTAP is functionally the same as a typical tap appliance. It pulls the mandible forward by using a midline anterior connector. And in fact, it was so familiar or so similar to the regular TAP that when the FDA went to clear the myTAP, they just said, fine, we'll use the same codes, the same 510K clearance. That's what is called at FDA. So it has a lot of studies behind it. We've studied the TAP quite a bit. We know how well it works. We can prove that it makes a difference for a lot of patients' breathing problems. The myTAP studies are going on. We've got a pilot study done. It looked really good. And there's bigger studies going on too. So yes, we do need to finish those studies, but the basic design, the basic structure works really well. We know that already. So there's, all right, Sam, I'm confused. I got to go back and see if I skipped something. Nope, I didn't.
Yeah, it looks like
Coming
I
up,
thought
huh?
your video was in there, but possibly it is after.
There it is. All right. How about that? Sorry, guys. Got myself a little confused there. So
Just before, Dr. Christensen, I don't mean to interrupt, but just before we get into that, there are a couple of questions of fees for myTAP and insurance questions. Do you want to answer those at the end during the Q&A section or now?
Well, I think I have a slide that has some fees and some things on there too, but I can answer them now. What the myTAP will cost your practice about $115, I believe, to get it shipped to your patients. So and you're going to be on a telemedicine call. It's not going to take that long. So my counsel is for you to make a reasonable fee for this. So I don't want you to lose money on this, but it's also not, I don't think, important for you to make a giant amount of money on this. I think it's something that you should get paid a few $100s for to make it professional, because it's a professional device. If you get paid by insurance, that'll be later on, and probably you should have them reimburse the patient for that later on. So I don't think you should be too concerned with the fee. I think you should make it affordable for your patients. I think you should make it to where it looks much more like a service, that you're providing a unique opportunity for them to be treated during this time of no patient visits, and less like, oh, I have something new to sell you. So just think about it that way. I think that's important that way. All right. So some key benefits for the myTAP is again, there's no need to wait. You can do this straight away. Now, I have some colleagues out there that are against sending temporary devices to unexamined patients, unexamined for this particular reason, unexamined for the appropriateness of using oral appliance therapy. And I respect my colleagues out there, but I don't agree. He doesn't agree with me, and we're good friends. And so on other webinars, you may hear this. And so what I want you to think about, though, is a couple things. One is that on a telemedicine call, because you have the ability to see the patient using Skype or one of the other programs, then you can actually have them do a range of motion demonstration for you. So you can see how they can open their mouth. You can ask them specific questions about jaw joint issues, about muscle pain. If they're your patients already, you have an idea for their periodontal health. And I wouldn't make a myTAP on somebody who's very brittle periodontal health, because there's a lot of risk there. But on typical patients, I think there's very little risk for this. And if it causes some discomfort in the jaw joints, well, first of all, it might do that. But it might also, that's probably transient, just like it is when we make our full-on custom devices. So you can talk your patients through that. And the very worst thing that you can do is have a patient who is they just haven't figured it out. They get too sore, they don't like it. They don't use it. They just take it out and stop using it. Well, another reason for you to make this a very low cost device for them, if you can, because that way you can choose to forgive all, some, none of the fee if they just hate the myTAP solution. Now, my advocacy would be for you to come up with a fee that says, look, we're going to give this a go. I don't know if it'll work specifically for you, patient, but if you agree and I agree, and we'll hold your hand through this, let's try this medical device to see if we can solve your medical issue and give it a go. And if it doesn't work, you know, it's medicine. Not everything works on everybody. And this is kind of what we do with our custom devices as well, isn't it? So we don't guarantee things in medicine. We just make sure we guarantee that we're going to put our maximum effort into this. So if you have somebody who risks a few $100s on a myTAP and it doesn't work for them for whatever reason, then really we want to set it up to where they don't come to you and say, well, you know, this was terrible. I want my $300 back. Well, don't, you know, just don't set yourself up for that. So I don't want to dwell on that too much. I probably have said too much already about that. But this tray technology is fantastic. And I'll tell you more about that when the video plays here in a bit, because I found the video. And we'll see how this works. And there's nothing else on the market that fits as well as a myTAP. There's nothing else that has the precision of fit. There's nothing else that allows a patient to take charge of their jaw position so it stays comfortable and can achieve an effective position. And there's absolutely nothing else that promotes nasal breathing like a myTAP. So there's a lot of features about this that I love about this. And I think it's just really a relationship builder for your patients. So there it is. I saw the order form the other day. It's $115. I've been ordering them for my patients. Some insurances I've been hearing have been paying for this if the physician prescribes it. So one of the outcomes of a telemedicine physician visit you can have is you can have the physician directed. You can ask them to do this for you and say, look, I can't do a custom device. And so you can have the physician say an interim device during the pandemic for it to be followed with a custom device later on would be the prescription you would be looking for. If you get that, then you can be following the physician's orders, and that'll give you your best chance of getting reimbursed or some kind of benefit from the insurance company. Again, I wouldn't really make that a big plus. And then if you have patients then that are ready to go, and you have some insurance information, you have a proof of concept using the interim device, they love how they feel, and they're going to be ready for a custom device that you can order up from Keller when they're back in practice. So here's our video. Let's have a look at this. This is the one I recorded. So I'm happy you're going to be able to get something to keep your airway open at nighttime. We've sent you a video that is produced by the company that makes your myTAP. Make sure you watch that video at least once, twice. Well, so I'm happy you're going to be able to get something to keep your airway open at nighttime. We've sent you a video that is produced by the company that makes your myTAP. Make sure you watch that video at least once, twice, whatever you need. It's pretty straightforward, and this fitting a myTAP is very easy, but you got to make sure you watch the video. This video is done so you have a little bit of extra help, some tips from somebody who's done hundreds and hundreds of myTAPs for people over many, many years. I think this is a fantastic little device. I'm sure you'll be able to use it well, but it does take a little bit of fitting. So what's a key here? Make sure that you have a few things. You need to boil some water. We use a little hot pot like this. You can get it anywhere. But if you don't have one of these, just use a teapot or use a pot on your stove. But it has to be boiling water. When you take the myTAP out of the device, out of the little gray box it comes in rather, then what you'll do is you'll take a clear plastic knob off the front and make sure you can separate the pieces. It's very important that you take the clear plastic knob and you put it back in the gray box, because it's very easy to lose that little clear plastic knob. And if you do, you won't have a myTAP to use at all because you can't find a replacement. And so put that back in the gray box and take these apart, just like this. Now, as you saw in the video, make sure you boil the upper one first. So the upper one's easy to put in your mouth. So you put this in boiling water, make sure it's a whole minute. Now, I'm not going to go through that because you just saw it on the video, but I'm going to show you a couple of tips. So after it's all heated up, the video says you put it over the teeth and you make sure it's straight. That's an important part. And once it's in your mouth, it says bite gently onto the myTAP. I want you to bite fairly firmly onto the myTAP with your lower teeth against the warmer upper one. So you bite firmly against the myTAP part, and the video also says do not push against the sides with your fingers. I want to change that too. So when it's warmed in your mouth, lined up straight, biting firmly, take your fingers and just push against the sides of your cheek to make sure this portion right here adapts to the sides of your upper teeth. We want it to kind of grip side to side on your upper arch. So go ahead and do that and leave it in your mouth for a full 3 minutes. That's very important as well. Then when you tease it out of your mouth after it's all nice and firmed up, it won't be completely cool. You put it in some cool water. You don't have to put it in ice water, but cool water is fine. And set that aside while you fit the lower one. Now here's a tip for the lower one. So now you put this in the boiling water, or you've boiled water and poured it over this and wait for at least a minute on both upper and lower to make sure that it gets all the way clear. When you go to put the lower one in your mouth, you'll want to make sure you open wide and lift your tongue to the roof of your mouth. So open and just lift your tongue up. So then when you put this in place, your tongue will be on top of this device. Very important about that. If you don't lift your tongue up, then very likely you'll fold over this inside portion here where your tongue, where this is next to your tongue. Don't worry if you do that. I'm going to tell you about that in just a minute. But lift your tongue up, put it in your mouth, and like on the upper one, you bite kind of firmly on it. But now, you can't push from the side. That's not really going to help you very much. This one you have to push with your tongue. So it's in your mouth, you're biting on it kind of firmly, not clenching, but kind of firmly. And then take your tongue and just move it side to side to push these little wings here against the sides of your lower teeth. So just move your tongue, not your body, just your tongue side to side. Now, if you don't think you can do that, then open a little bit, take your wet finger and make sure and just rub it next to the insides of those lower teeth. And then after 3 minutes of kind of going back and forth on that, then you can tease it out and put it in the cold water as well. It's important to have a wet finger when you're managing these. It's also important to make sure you don't boil them together, because if you put them together in hot water, they stick to each other. Don't worry. Just keep boiling the water. You might have to pull them out together and put them in boiling water, and then they'll separate. So hot water won't do, but boiling water will. Now here's an extra cool tip for working with this material. If you've put it in place and you didn't get it quite right, something folded over, it doesn't fit your teeth very well, for whatever reason, it doesn't work out well, there's a magic part of this. You put it back in the pot that you were boiling the water in and boil it some more. So if you have a stovetop pot, just put it in that and boil it. So as you boil, you can't hurt it, as you boil, it'll return to this shape. Doesn't do that with hot water. You have to put it in boiling water and wait just a little bit, and you'll see it come back to shape. Don't try and unfold it. Don't take an instrument or a spoon or a fork and pull it open, that kind of thing. Just put it in the water. It'll return to its normal shape, and then take it out, let it cool down a little bit, and then you can put it back in your mouth and try again. And you can do that a bunch of different times. Of course, we're here to help you, so if you need some coaching on this, just give us a call and we'll get in touch with you about that. But I think you'll be able to see how that works out super well that way. If you're having trouble fitting it in your mouth, then you can take a spoon or something and hold your cheek out of the way. Just any way you can kind of work it in there to make sure it lines up over your teeth, and then fit it up over your teeth to make it work well, or fit it over the lower teeth, those kind of things. Those are all little tips you can use for that. Make sure you don't put these together when they're at the same time, when they're sticky or they're clear. So if you fitted the upper one, you got to take that out of your mouth before you fit the lower one. If you don't do that, they'll stick together. And here's something else that you might discover about that lower one. After you make the lower one, every now and then, on some people's arches, they have a little part of it in the back that sticks up. You can see this little portion that sticks up. Sometimes it's a lot bigger than that. It sticks way up here. if you find that's true in your mouth, it might feel uncomfortable later. So if you have a little part on the lower that sticks up like that, then what you do is you just heat up that end of it. So you just put that end of it in hot water and get a little bit soft, and just take some scissors and cut it off. It won't work if you try and cut it when it's not hot, and you don't want to set the whole thing in hot water because you don't need to refit it. But all you got to do is heat up that little section, cut off the part that sticks up, and it'll make it a lot more comfortable for you. Very important little tip right there. So once you've had this all fitted, so it's nice and that cooled down, when you put it over your teeth, it might be very tight because this stuff shrinks a little bit. That's okay. It's actually better to be too tight than too loose. But if it's too tight so it's uncomfortable, then what you do then is just dip it in some warm water and put it in, take it out, put it in, take it out. You can do one at a time or both of them at that point because you're not really heating them up all the way. So you put it in, take it out, put it in, take it out, and that way it'll loosen it, relax the fit just a little bit, and you'll be able to make sure that that works out well for you. So it's pretty simple to make a myTAP that works. It's a little technique parts, but it's really just about doing simple things. Watch the video, watch this video, think about it a little bit, and you'll be able to make a myTAP that'll fit you very well and get a chance to help you breathe really great while we're waiting for a chance to do a custom device, or whether your CPAP is going to work again for you, or whatever reason we're doing a myTAP during this time. So I hope that you like it, and call us if you have any concerns. So that video, well, Sam?
Yes.
Oh, there it goes. All right, so guys, that video, I recorded that just so you could see what I was trying to do, is help the patient through this. My best recommendation for you guys is to make your own video. Just write down the points and make your own video so you can put it on your own sites and send it to your own patients that way. You're welcome to use that one. There's a couple of other videos that I go through making an AM aligner, and I talk about nasal breathing and how to use a shield and how to adjust it. Those resources are all totally available for you. So please use them if you want to, but re-record your own if you want to. I just put my iPhone on a little stand with a light and recorded that. As you can see, I was talking to the patient. So do it whatever way works best for you. So how else can you make this work here? For undiagnosed patients, you consult with your patient by telemedicine, and then the myTAP is shipped directly to them, and then they fit the myTAP at home. And then later, the emphasis is that these are not diagnosed yet. This is an interim device. This is giving them something to make it through. And then later, you're going to be working with them to get an actual diagnosis to see about this. My counsel for the undiagnosed patients are for the highly motivated patients, for the patients who are extra sleepy, so you're worried about their health, for the patients who have a known problem and it's much worse right now and they're clamoring for help, and there's not a way for you to get them help in your town straight away. And so let's get them something going. We just don't want to send a message that, for example, around here, we can't see a patient until officially May 18th, but we all think it's June 1st. So I'm just not going to tell somebody who gets a hold of me as a Airway provided dentist and says, look, I need some help. And I say, well, I can't help you for 6 more weeks. I'm not going to tell people that. I'm going to tell people, yes, I can help you right now. So let's do something about that. So we follow up with them and make sure that we're doing the right thing as we can. For that diagnosed patient with an existing appliance, whether you want to make sure that you can get a myTAP in their hands right away, and then you can work with them on what we're going to do about their oral appliance now. Can we send it in for repairs? Keller's working right now. They're open. So if you have their appliance, you can take their appliance, clean it properly, and then package it up and send it to Keller, and they can see about getting a repair done. If you have the models or printed models or scans or those other supporting details, you need that as well. But we can get patients into something while we're waiting for the manufacturers to turn around a repair or to make a replacement for us. And so again, we can address those long-term objectives after we use the myTAP, but we're able to address their issues straight away. So telemedicine is legal everywhere right now. It's actually getting more and more available for all of us. And you can actually use your phone like Skype or something to talk to your patients. HIPAA applies, but frankly, nobody's going to get onto you about HIPAA right now. So just get a hold of your patients and talk to them. This may be a service that you're going to really enjoy. And I think we're all going to be doing much more telemedicine. So choose a portal that you like, choose something you can start with right away, and then you'll refine what you want and don't want. So you may choose something that doesn't cost much, it's easy to use, and then later it's to say, you know what, I want more capabilities. I want to do this, I want to do that. But right now, if you don't know anything about telemedicine, you haven't done any of this so far, you know, you're like us. You don't know what you want, what you don't want. And so as you get started with this, then you and your team will be able to figure out what it is that you want to make sure you're doing. The American Academy of Sleep Medicine has some recommendations for this. They have a telemedicine portal as well called Sleep TM. And that's worthy of your assessment to see if you like that one. So some key actions is choose that. And then get in touch with, my recommendation is Pristine Medical Billing, SleepMedRx, SleepTest.com. Get in touch with somebody who's already doing it, that can handhold you through this early discovery phase that you can trust. And then if you stay with them, great. If you learn more and you want to go somewhere else, that's fine too. Get a couple of your team members on board with this. So do a Zoom call. Say, what do you guys think about doing this? What do you think about that? And get them engaged with the process as well. That'll be helpful for you. Make your own videos and then send your patients a notice that you have a service that you're able, willing, ready, and excited about providing straight away. Now, if you're living in an area where you can do some scans or impressions, then you can offer custom devices because, again, Keller's open and ready for business. But assuming you're not, then set them up for success in the future. So there's our talk today. Sam, let's put up the video links here. And what questions do we have that we can discuss?
One thing I wanted to note that I wrote down was that the myTAP does have a 30-day compliance through us, the manufacturer. So if for some reason the patient, it doesn't work for them or they don't like it, we will refund or credit your account. Granted, that's not what the patient pays, but we will or send you a new one free of charge so that you can use that one on another patient.
Well, so I like that because then what it means to all of you out there is if you work it out with a patient, they get a myTAP drop shipped to them, your exposure is actually very little. Because if they say, I hate this and I won't use it, my Airway Technologies will give you another one. Oh, I like it.
Correct.
All right.
Correct. The other questions we had, I believe you addressed the fees for myTAP and teledentistry, but one of the questions was if you do bill insurance, the myTAP insurance, will that affect insurance paying for a final appliance down the road?
That has not been fully tested, and certainly with as many insurance companies as there are out there, well, I can't really certify that one way or the other. But my counsel on that one would be twofold. One is if you have a physician who's you're working with who prescribes the myTAP, and so that means you've done a telemedicine call and a physician has sent a prescription for an interim device. And I would have them phrase it that way. A prescription for an interim device to use until a custom device can be fabricated. Now you've got a physician directing you to do this. So that would be a first step. If you don't want to do it that way, that's fine too. But what I would counsel you to do is make a reasonably low fee for the myTAP and then tell your patient, look, the insurance company isn't going to pay for a temporary device and then pay for a custom device. I think most patients will understand that. And that's the safest way to go for that. Now, in our office, we have had patients or insurance companies pay for for interim devices and custom devices. And we have the majority of our insurance companies though just don't pay for the EO485s. They just don't do it. They don't have a benefit for that. So it's kind of it's a mixed answer because there's no one answer for you out there. Yeah. I would certainly set the expectation in your patient's mind that the insurance companies will pay for E0486 because they will, but they may or may not pay for an E0485.
Great. We did have another question come through asking how long the fabricated myTAPs last.
Yeah.
From a manufacturer's perspective, it depends on how it's taken care of, but Dr. Christensen, I will pass that along to you for experience.
Well, from a clinician standpoint, it depends on how well it's taken care of. So just like what you said, Sam. And what the deal is that what I tell patients is, I don't know how long this will last. It's a robust device. It doesn't break down easily. But if you're a clincher grinder and you're going to, do a lot on that, it is just a plastic device. And so it may or may not last that long. But we've had it in patients' mouths for months and months and months, and it's just fine. In fact, I'll anticipate another question I get quite a bit is that, well, what if they don't come back for a custom device? They like their temporary device. The answer is some patients will do that. They will say, oh, I'm fine with this one. Okay, that's great. Live with it that way. When you're ready for a custom one, I'll be here for you. Just don't argue with them about that. Most patients will recognize that they like what's happening. They like their airways open. They like their nasal breathing. They like their lack of snoring. But what they don't like is the thing that sticks out from between their lips. They're fine with it for a short term, but they don't really want to have that for a long term. It is a little something to get used to. They do get used to it. It's fine. But then they're ready to have something that doesn't do that. And so you bring them back and say, look, I've got the same device, sort of, without the part that sticks out. So we make them a Dream Tap, we make them a Tap 3 with an AccuFit liner, the same white material that you like how it fits on your teeth now, well, you like how it fits on your teeth later too. And we can do all those things for you going forward. And there's some new exciting things coming from Keller as well, I hear. So we'll see.
Fantastic. A couple more questions. When do you use the mouth shield, and do you have the patient fit the AM aligner as well?
One of the videos that I didn't take the time to show you is we do walk them through making the AM aligner. It's not the same one we make in the office, but they do make an AM aligner. We also give them some instructions. We can do. It's a real simple video that you can make to show them some stretching exercises, some repositioning exercises using the AM aligner that comes in the myTAP kit. So that's pretty straightforward that way. In terms of the mouth shield, I love the mouth shield. I default to the mouth shield, so I use it on every single patient. The only ones that don't use the mouth shield are the ones that just absolutely can't breathe through their nose. I mentioned the pollen. What if they're having a terrible rhinitis from the pollen? Well, they need to breathe through their mouth right now, so you leave the mouth shield off, and they breathe right around the myTAP, and they're just fine. And actually, oropharynx is more open, and they're okay that way. But we do want to try and get them into the mouth shield for that. And I've had a few patients that have done this. The mouth shield is soft and silicone. Part of it covers the adjuster stick out the front. And there's one of the videos is about how to adjust it as well. So it's right there for you. And they can actually take a scissors and they can cut everything except the cover off if they want to. And so they can have the cover benefit. So the adjuster system isn't, is soft on their lips. And they still can breathe around it too. So there's lots of ways to make this customized for your individual patient. That's one of the things I like about this, is you can make it precision medicine here.
Fantastic. Does anyone have any other questions? I'll give you guys a couple minutes to type any additional questions you may have. And just to let you all know, after this, we will be sending out the webinar recording, as well as information on how to contact Keller to get your myTAP or custom appliance during this time. And then if you have any additional questions, there will be contact information in there as well.
I'm happy to answer any questions later on too. You can send them through Keller, you can send them through Airway Technologies. My email should be on there. So if I can help you guys, I'm all in.
All right. It looks like there are no other questions other than multiple people telling great presentation, and thanks for doing the presentation, Dr. Carstensen. If there are no other questions, we will end this here momentarily. And as I said, I will be doing follow-up. And so if you have any questions, please let me know. Actually, a question just came through. are physicians billing for EO485?
I'm sure there are physicians out there billing for that. Some ENTs I've heard of doing these, but there's not very many. If they get a patient's airway open, they're not going to make a custom device because most physicians aren't comfortable dealing with TMD issues. And all of these devices have a potential to cause a little soreness here and there. And if that happens, that's going to scare the physicians off. And so, don't be worried about physicians making EO485s out there. It's not going to be a significant number. And there's so many people that need to be treated that if the physician is so aware of this, that they are willing to make an EO485, then buddy up to that physician and say, I'm happy to help you. If you struggle with this, let me coach you on this. I want to be here for you. If you have a patient in trouble, just send them on over. I'll fix it for you. Just really be their friend. And pretty soon they're going to be sending all of their patients to the expert, which is you.
Great advice. All right. Well, we will go ahead and end this. Thank you, Dr. Carstensen, again for doing the presentation, and thank you, NDX Keller, for putting this together as well.
Yeah. Thanks,
and
Em.
again, if you have any questions, we are always here for you via email or phone. I know Keller and NDX are also available, and Dr. Carstensen is available. We will send out all the contact information after the webinar.
Great. Good.
All right. Have a great day, everybody.
Bye.
Bye.